Hello, my name is Tiffany, and today I'm going to inform you how addiction affects those around them. How many of you have a friend or family member that is struggling with drug addiction? I do. According to the National Survey on Drug Use and Health, 21.5 million American adults aged 12 and older battled drug addiction in 2014. Addiction affects the individual along with everyone around them. Because my loved one is battling addiction and fighting for recovery, I have experienced several phases that come along with that, including but not limited to knowing common signs and symptoms of drug abuse, trying to keep resentment and anger from ruining your relationship, and also how to help without enabling. The very first phase you will have to deal with is determining whether their recently strange behavior means drug abuse or just a change. There are a few different signs: physical, behavioral, and psychological. Physical warnings include bloodshot eyes, changes in appetite and sleeping patterns, sudden weight change, poor hygiene, sores on their skin or face, unusual smells on their mouth, body, or clothes, and also tremors, slurred speech, or impaired coordination. So if they're falling over, tripping, their eyes are closed, or their pupils are really big, or their pupils are really small, they're staying awake all night, or they're picking or scratching, those are all red flags. Some behavioral warning signs include dropping in your attendance and performance drop in school or work, unexplained need for money, or they're all of a sudden having some financial problems. They might borrow money from you or steal from you. They also may borrow, steal valuable items that they can exchange for cash or drugs, or just sell or exchange. Engaging in sudden or secret or suspicious behaviors. All of a sudden they're evasive and vague and you don't know what they're doing. They also may become more aggressive and possibly establish a criminal record. Big red flag. Some psychological warning signs to look for are unexplained changes in personality or attitude, sudden mood swings, irritability, or angry outbursts, periods of unusual hyperactivity, agitation, or giddiness, lack of motivation, and they also may appear anxious, fearful, or paranoid for no reason. Mental exhaustion and other emotions occur during this process. So by the time that you confirm that your loved one is using, you are already mentally exhausted. The confirmation brings on a whole new set of emotions, including disappointment, confusion, and the need for answers. For those who care about another, which is an article I found, has some great tips for helping maintain your relationship and communication throughout this difficult time and process. Your relationship may be strained and almost to an end, but it is important to keep communication open, and that's how you will help them reach recovery and get through this together. Some tips for a healthy relationship that they suggested are accepting your partner as is. You can't change them. You help them. Avoid blaming. Allow yourself to influence without demanding. Express appreciation frequently, and don't forget that there is no instant gratification. So if there's a relapse, that does not mean that they won't recover. That just means there was a relapse. According to Are You Helping or Enabling? A lot of people enable and don't realize it. So some enabling things to be careful of would be giving money blindly. So you want to make sure you're holding them accountable for every penny they have been given. You don't want to. Enabling is pretending everything is normal during a relapse. When a relapse happens, it's not normal. That will just make them think that nobody noticed and they can get away with it. Suppressing your feelings, they don't do that. They need to know how you feel and how others feel and what they look like and how they act. Blaming or punishing them, that will also maybe resort back to their initial reason for turning to drugs. And don't try to control them or hover them. They will be sneaky. You are there to help, not change. You can't control them. You can control yourself. Some helpful behaviors they suggest would be to attend meetings regularly. Meetings help them. That way you know exactly what they're hearing, what they're trying to accomplish, and you can talk about what you heard, things like that. You're on the same page. Set boundaries and stick to them, just like you do when you're with your 2-year-old at the store. You tell your 2-year-old if you throw a fit, you're going to leave. Your 2-year-old throws a fit, you leave the store. Do that with your loved one. Stop making excuses. Again, this makes them think that they can get away with it, and they'll continue to do it. Or they're more likely to continue if they relapse. Participate in family therapy. A lot of A lot of drug addicts don't want to. A lot of my friends and families, they don't want to do family therapy. They want to go through it alone, and they can't. They won't be successful alone. The minute they learn that, they will want to do family therapy, and they will need you. So be prepared to fully commit to treatment through the ups and the downs. You need to be there for them. Don't give up. They can do it. You can do it. Stay strong. Okay, so having a loved one who's struggling with a drug addiction is challenging for the both of you. It is important to catch it as soon as possible, and don't be afraid to address the issue. The more education you have, the easier the process can be. There's so much involved with loving someone who has a drug addiction. I hope knowing some common signs to look for, how to help keep the relationship healthy and open, and learning some ways to help without enabling will prove to be beneficial if you are ever in this situation. Thank you.